lay them out like you work at Subway and you are making a nice little sandwich. Hi everyone, so Elizabeth, aka Nurse Zabe here on YouTube and Instagram, back at you with another video. This one's going to be all about tearing. Before we jump into that, I just wanted to give a quick little update on my last video, which was all about placentas. I talked a little bit about placenta encapsulation and how we don't have a ton of research about it. I got a few comments, as well as when speaking with another childbirth educator that I work with, that I kind of left out something that I think is important for you guys to know. My goal is to give you as much education as possible. So if you don't care about this, I will put a timestamp in the comments when you can skip to get to the rest of the video. So we talked about placental encapsulation, placental ingestion, the thought that there was iron stores that could be useful for mom, and that the estrogen and progesterone perhaps could help with postpartum depression. None of these have been proven by studies. These are both anecdotal. But another thing that can actually be an issue with consuming that placenta, also in regards to the progesterone and estrogen in it, is establishing a full and robust milk supply. So we know that the drop in these hormones is what initiates lactogenesis 2, which is our milk coming in. And when you are continually ingesting these hormones and keeping it more at a steady state, there have been some studies and some anecdotal evidence to suggest that we can have issues with developing a robust milk supply. So the whole point of me talking about eating your placenta in that video in an open and honest way is so that if that's something that you choose to do, having all the information. If it's something that you choose not to do, not being judgmental for other people making different choices than you. Because birth is all about choice. It's all about the choices that we make and just making sure that we are being non-judgmental towards other people. But for those of you who did wonder, I just looked at my placenta, thought, hey, that's cool, and then it did go to be disposed of with Holden. With May, it actually got sent to pathology because I had been ruptured for so long and had developed a fever, so they wanted to check and see if I had had chorioamnitis. But anyway, I digress. Back to tearing. So tearing or lacerations are something that a lot of women are very, 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 very fearful of in childbirth. And I understand that fear, because when we're thinking about a very vulnerable part of our body, our vagina and our labia and that whole area, having a baby come through there, we're worried about having significant tearing, and I understand that. I think what's really important to remember, and what I want kind of your take home from this to be, is small, minimal tearing in childbirth is totally normal. Okay, a lot of women are going to experience it, and it's not something that you should be afraid of. It is part of normal physiological childbirth. There are things that we can do to help prevent those tears, but some of those are just going to happen because even though we've got this estrogen that's making our tissue nice and pliable, this elastin that's making our tissue stretch, we still have our vagina opening up to 3 times its normal size to fit out the head of an infant. And depending on the size of the infant, the position in which it's presenting, and just the amount of space that your own personal vagina has, there might be some tearing. And some first and second degree tearing is very, very normal. We are going to see about 50 to almost 80% of women have some sort of tearing during childbirth. But the majority of these are minimal and minor and will heal up within a few weeks with no other issues. What we really need to work on preventing is routine episiotomy, which we're already working on in the United States and have done a great job of reducing. And we're also working on decreasing severe tearing, so those 3rd and 4th degree tearings. I'm going to go more into 1st, 2nd, 3rd, 4th, what all those mean in just a minute, but I want to put this up front first, that some minimal tearing is really normal. I had tearing with both of my children. I had a 2nd degree with my first child, and then I had a 1st degree with my 2nd child. And honestly, what for me was more of an issue than the tearing was the hemorrhoids that accompanied the birth of my beautiful bundles of joy. I also birthed a couple of little hemorrhoids that we had to deal with. Those honestly were more uncomfortable, but I'm going to show you guys how to take care of your bottom after you have a tear, whether it's minimal or significant, to provide the most comfort. And we're going to talk about what we can do to help reduce the risk of severe tearing. So first off, let's go ahead and talk about what tears are. So when you deliver vaginally, there is kind of a possibility of having some tears. Now these tears can be in that perineum area. That's where we're most likely to see tearing, and that is the area between the anus and the vagina. Hold on. Okay, I'm gonna try and draw this for you guys. Now I am not an artist, I am a nurse. So if we have this is your vaginal opening, labia, clitoral hood is up here near your urethra, and then your anus is down here. Perineum is this area between the bottom of your vagina and your anus. This is where we see a lot of tearing, but you can have some tearing, some vaginal wall tearing. You can tear, you know, up this way towards the urethra. You might have some superficial tearing on your labia perhaps, but the main area where we see a lot of tearing is right here. And so there are 4 different degrees of tearing, and how we grade them is how far you tear. So a first degree is just going to be that you just have a little tear in the skin in this area. Sometimes those require stitches, sometimes they don't. What really depends is how much they're bleeding. So if the doctor can apply a little bit of pressure and the bleeding stops, then we won't do any stitches. But if there is some bleeding, then that might need a little stitch or 2. A second degree tear is when you tear through the skin and then through the muscle in that perineal wall. And so that typically will require some stitches. The majority of the tears that we see are first and second degree tears, okay? So those are the ones that heal up within a couple of weeks. Everything's gonna be pretty status quo after that. Now the more significant tears are the ones that start to involve the anal sphincter. So a third degree tear, you're gonna tear through the skin and through the muscle and down into the anal sphincter. And then a 4th degree tear is our most significant tear, and that's when we tear all the way through the entire sphincter and into the anal cavity. So obviously those are the types of tearing that we really want to avoid, because they require a lot more physical therapy after delivery, a really good job suturing them up, and just making sure that everything is working as it can. Now I do know women who have had 4th degree tears who go on to have a second vaginal delivery with no such issue. So just because you have a 4th degree tear does not mean that you will necessarily have one again, and it does not necessarily mean that you need to have a cesarean birth if that is not your choice. But if you've had a 4th degree tear, your doctor will give you the option of having a cesarean birth if that is your choice due to the trauma that you experienced in that perineal cavity area after your first delivery. Along with these tears, there is something called an episiotomy, which is where your doctor or your midwife would use scissors to artificially make that area bigger. And the thought process was back in the day, okay, we use these scissors, a nice clean line is so much easier for us to suture back up. But what we're figuring out, or what we did figure out, is that your muscle fibers in that area actually act more like bricks. So when you tear naturally and then we suture you back up, we have a much less instance of having issues with that suturing. Mom heals better, mom feels better, and things look better overall than when we are artificially cutting things. And think about that. Me pulling on this piece of paper, right? There is some resistance because it's intact. I cut this paper first, and then we have some tearing of baby coming. Do you see how much easier that was to tear? So another reason why we try to avoid episiotomies is because they are more likely to extend into more significant tears. But if you just have an episiotomy that doesn't extend into a more significant tear, it's similar to a 2nd degree laceration in its depth. Now, there are some times when episiotomies are necessary, and these would mostly be for the safety of your baby. So perhaps your baby's heart rate is down significantly and we need to expedite labor. Your doctor would let you know, like, hey, your baby's heart rate is down. Is it okay if I perform an episiotomy for the safety of your baby? And I think most people would say yes to that. And with good reason, because sometimes we just need to get baby out quickly. The other instance where this might occur is in a shoulder dystocia, which means that the head of the baby has been delivered, but the shoulder is impacted. One of the maneuvers that a doctor does or a midwife will perform further down we have kind of a list that we go through trying to get that shoulder out and get your baby safely delivered and get oxygen, is to perform an episiotomy so that they have more room to get in and manually rotate the shoulders. Again, this is an emergency situation, and there probably still will be a conversation. I'm going to cut an episiotomy to safely deliver your baby. Nobody should be cutting an episiotomy for absolutely no reason and without your consent, okay? But when we cut an episiotomy, there are two different ways in which we can do it. There is midline episiotomy and then medial lateral. So midline would be kind of straight down. Medial lateral will be to the side, or either side. The medial lateral is going to have less a chance of extending into a really significant tear. That's the one that they're going to choose to do most of the time. But this is all a changing practice and culture. So back in the 90s, like 55% of women were getting routine episiotomies with no medical justification for them, simply because we thought, what I can control, I can suture better and it will heal better. But now we know what nature controls heals better. So right now, we love to see hospitals with the rate of episiotomies under 5%. That kind of accounts for all of those emergency situations that could arise. And leapfrog.org, which I've talked about before for looking up C-section rates, you can actually also look up episiotomy rates. So if you are choosing between providers and choosing between hospitals in your area, go look that up before you decide. We're going to kind of go through all the things that we can do to reduce your risk of tearing. Some of these things you can do at home before you even come in, and some of the things we will be doing in labor. Some research to suggest that perineal massage with a little bit of oil or lubricant is going to be really beneficial in helping make sure that that tissue is nice and stretchy. So starting at 34 to 35 weeks with your first pregnancy is where we're seeing this actually be helpful. Doing 10 minutes of perineal massage every day. That's something that you could do, that you could have your partner do. Doing this can be helpful in reducing our risk of tearing significantly. Another thing that we can do in labor is some warm compresses. So they're going to be close to the temperature of your body, perhaps a little bit warmer, nothing hot. We don't want hot compresses because that can increase swelling in the area, but some nice warm compresses on your bottom while you're pushing can help. Something else that can help, and we'll notice a lot of physicians doing, is called guarding, where the physician will kind of keep their hand on your bottom to provide a little bit of counter pressure as baby's head is coming down. Now, if you don't have an epidural, as baby's head is starting to crown, you're going to feel what we lovingly refer to in the birth community as the ring of fire. This ring of fire is your body's way of letting you know that it's stretching, because that's what you're feeling. It's your body's way of saying, whoa, slow down, take a breath, ease me out nice and gently, okay? Nice, gentle pushes at the end, easing out the head, are going to be the best way to let our body stretch to its full capacity without tearing. We don't want, and sometimes it's really hard to not do that, but listen to the stretching. And if you do have an epidural and you don't feel that burning, stretching sensation, then listen to the people who are helping you push. Sometimes this is the point where we ask family to kind of tone down their encouragement. While we love encouragement, we really want the physician and the midwife to have a good line of communication open with the patient so that we can say, okay, give me little half pushes, okay, blow it out, okay, little half pushes, to not forcefully expel out the baby. Because while we're gonna feel a lot of pressure and it'll feel really good to get all that pressure to go away, we don't wanna do it in a really fast fashion because that can incur more tearing. Some things that can help reduce the risk of severe tearing, so 3rd and 4th degree tears, but can increase your risk of 1st and 2nd degree tears, are birthing in an upright position and birthing in water, if that is something that is available to you at your local birth center or hospital. Upright birthing positions like squatting, thrown, sitting on a birthing stool, things of this nature can help reduce the risk of significant tearing, because when we're in that lithotomy position with our legs back, that area is more stretched. Now, both upright birthing positions and birthing in water can increase your risk of 1st and 2nd degree tears, but again, those kind of we seem to expect with labor, and we don't exactly know what's behind those increased risks of tearing. It might just be also that birthing those positions decreases your risk of receiving an episiotomy, so perhaps the increase in 2nd degree tears is just a decrease in episiotomy, kind of going, something was going to have to give somewhere, is what I'm saying, if that makes sense. So we've just had a baby. we've had a tear, regardless of how significant it was. After you deliver your baby, and after you deliver your placenta, doctor is going to kind of look at your bottom and see what sort of tearing we have. And then, depending on how much you're feeling, so if you have an epidural and you're feeling nothing, they will just suture with the epidural. But if you have an epidural and you're feeling sharpness, or if you don't have an epidural, then we will use some lidocaine to numb the area before we start suturing. If you are feeling too much when they are suturing, now it's normal sometimes to feel pressure, but you shouldn't feel any sharp pain. If you are feeling too much, please, please, please don't try to muscle through it. Ask for more lidocaine, because that is what it's there for. Now lidocaine, we talked about you get lidocaine when you get an epidural. It's kind of a bee sting in your bottom. I had lidocaine with Holden because I didn't have an epidural, and I was kind of like, whoa, but then I didn't really feel anything after that, because you don't really want to feel anything after that. Like, you just had your baby and your body is kind of like in adrenaline overdrive, and the last thing you want to do is kick your doctor in the face because you can feel every part of your repair. Maybe the first thing you want to do, because they need to be using a little bit more lidocaine. So please ask for more pain relief if you are feeling too much. So after everything is all sutured up, if that needs to happen, then we will probably use some ice on your bottom. We know that leaving ice continuously on that perineal area is not good for the cells, but doing ice on and off as management for soreness and for swelling can be useful. So your nurse might give you some ice in a glove with a little covering over that. Or, pro tip, if things are particularly uncomfortable, if you take a diaper, rip or use scissors to open up the back of the diaper. And then this thing opens all the way up, and you can fill this up with some ice and fold the back of the diaper, down and use the tabs to secure it in place. This is going to be a little bit softer on your bottom. It's going to absorb bleeding, which the ice glove will not. And it also is going to absorb the ice as it melts, so you don't wake up thinking that you are having significant bleeding or hemorrhage when it's actually just that your ice is melted out all over your bed. We want to alternate using ice and then not using ice for the first 24 hours. Every time you go to the bathroom, because we don't want to be doing rub, 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 scrub, scrub, scrub on your bottom, if it has tears, or even if it doesn't have tears, if you've pushed out a baby, you have little micro abrasions going on. So using your squirt bottle can be really, really helpful. And if you notice, you're going to fill this up with warm water before you go to the bathroom. If you notice, if you're like, oh my gosh, when I pee, it burns. My pee is hitting that tearing. Well, first of all, drink more water, because that's always the solution, and that's going to help dilute your urine more. But another way to dilute your urine is with your squirt bottle. So spray this while you're peeing, and then spray it afterwards to get everything cleaned up, and then pat, pat, pat with toilet paper. We don't want any roughness going on. You also are going to be using some witch hazel pads. These, I like to say, okay, let's put on our pad that's up against our bottom. Lay them out like you work at Subway and you are making a nice little sandwich. These are going to provide some cooling benefits. These feel great on hemorrhoids too. These also feel extra nice if you throw them in the fridge when you get home. As you start bleeding a little bit less after the first few days postpartum, those stitches are going to start to feel a little bit dry and itchy and pulley, and that's where I really think these come in handy. So when they give you these in the hospital, make sure that you take them home. These are also going to be getting some numbing spray for your bottom, and you're going to spray that all around. If you're having a lot of burning before you pee, you can spray this before, but then after you pee, this feels awesome on any tearing. So after the first 24 hours, it's really nice to get some heat treatments on your bottom, and that is where a sitz bath is amazing. So this is the sitz bath. You can get them at the drugstore as well. This also feels bomb for your roids. If you got some roid rage going on, which is what I call it when you have hemorrhoids and you're angry, aka me, this is really useful. So basically, it's kind of like a lavage for your bottom. It's a nice little jacuzzi tub for your bottom. If you don't have something like this, and you have the ability to really sterilize a bathtub and sit in a bathtub with running water, the whole point is that you're not sitting in water that's just sitting still, because that can breed infection. but this is movement of water. So this would go inside your toilet. You sit up both seats of the toilet so that you could sit on this. Put nice warm water in this, a little bit hotter water in this bag, and then this sits kind of up to gravity. You open this, and then you've got a little jacuzzi whirlpool for your bottom. Some people will put other things in here, but I only have ever just used water. That's all I've ever instructed patients to do. You think this wouldn't do anything? It is amazing. Time and time again, people are like, Elizabeth, thank you for the sitz bath. And I'm like, girl, I got you, because it's really nice to have. It's really nice to have. So everything that they gave you in the hospital, please take home with you and use to keep your bottom feeling happy and healthy and comfortable. I hope that video was helpful for you guys. Definitely let me know if you have any questions down below. And till next time, stay safe and well. Bye, guys.